Ashley with Amare. So, I've been saying I'm going to do this video forever. I have a lot of other ones that I really want to do and that I'm super excited about, but this one's super important. So, Lipo Foams. All right, I have a video on boards and about why we hate them, right? And you guys are always like getting these things from your doctor, like in Miami or even out here, and it's like sponge. Sometimes it's like a triangle sponge, or you buy the M&D backboard, which is like a sponge. Guys, none of that stuff works. Go back to my board video, and I talk about in there how that stuff is too hard to be using against your body. So we're not going to use that anymore, okay? We're going to just use foam. Now, you cannot just buy any foam on Amazon and use that in your garment because it causes certain fibrosis. Because again, anything that's going to trap the movement of your skin, a garment that's too tight, or foams that are pushing into your body is going to leave those lines and those creases, which is why a lot of doctors say that they don't want you using them or want you using anything in your faja because it leaves those lines. But there is an actual difference between the stuff you're getting on Amazon and why it doesn't work. So let's talk about the sticky ones first. I have samples of this and they're actually stuck together. But as you can see, they're super adhesive. What is wrong with this foam? Well, first of all, so the point of foam, let's talk about that, right? So Lipo Foams are meant to protect you from your garment. Now, a lot of places in Miami will tell you, wear a tank top under your garment, and you still wind up getting garment burn. The tank top is still not gonna protect you from the garment crushing into your results. So they give you the foam and the sponge, right, to help get the swelling out. Okay, again, that stuff is hard and gonna push into you. The common thing that they will give you or put on you is this sticky, adhesive, super, super sticky foam. Now, first of all, this is not machine washable. That is gross because it's in your garment 24/7. Second of all, if I can squish this, and I'm not really putting any pressure, but there's no support in there. I can feel my fingers in between. If you guys have foam on and you can like easily press and feel your fingers in between, it's not gonna hold up under the weight of your garment. And what's gonna happen is the foam is gonna push into your body from the garment pushing against the foam. It's gonna still cause creases and lines. Also, this adhesive on this foam will stop your skin from moving. Why is that a problem? Because the lymphatic fluid, as we know, is just beneath your skin. The swelling is just beneath your skin. First of all, anytime you take those off, you're ripping at your skin that's already sensitive. So that's a big no-go to begin with. We want to protect our skin. We already talk about that in my other videos where I talk about proper post-op soap to make sure your skin isn't compromised, proper wound care to make sure your skin isn't compromised. So again, that adhesive compromises your skin. It traps moisture definitely because it's adhesive and it's sticking to you, kind of like a wet Band-Aid would. And it's again, stopping your skin from moving. So you're not getting any movement in your garment. So there's that, no adhesive. Second of all, like I said, this is too thin. So there is a difference. This is memory foam, you know, like a Tempur-Pedic bed, memory foam that collapses. And adhesive, and then there's like the hard sponge. Those are usually the foams that you get. If you're buying them on Amazon, you're probably gonna get that memory foam type thing. That will absorb everything, and when you try to wash it, it'll get really thick and heavy and soggy. That's super gross. So, this is our Lipo Foam, okay? When I squeeze this, do you see the difference in how much? I mean, I'm like squeezing. You see how much, even if I like push, how much is still there, and I'm really squeezing. When I squeeze this, I'm barely squeezing and it collapses. If I really squish, my fingers touch. So you have no support with these memory foams. With our polyurethane foam, that's not gonna happen. It's not, there's still foam in between there. Even when I like really pinch, you still get that foam. It doesn't collapse. So that's gonna, number one, push the garment away from your body and protect you. Most important thing with the foams. Guys, even if you don't have fibrosis and you're wearing a garment, even if it's not the Amare garment, if it's a Morena garment where it's super stretchy, if it's a faja colombianas where it's really constricting and tight, these foams are one, gonna make sure you're not getting crushed, causing worse problems with your swelling. Two, protect your incisions. Why? Because when you have incisions, even if they're tiny little holes with stitches, the weight of that garment pushing onto that incision is gonna cause really bad fluid to pool underneath and really bad scarring. So it's gonna build up fluid underneath that scar and cause it to be really thick and puffy from your garment, constantly crushing into you and crushing and squeezing that wound. Again, super dangerous with tummy tucks, still dangerous even if you just have a little bit of a cut. So that protects you from being crushed. This polyurethane Lipo Foam, the Amare Lipo Foam. not the memory foam. The memory foam you're still getting crushed with. The sponge, same thing. It's pushing into your body. The garment's pushing against it, and it's crushing into your body, causing that trapping of fluid. So that's the number one thing that this does, is it protects you from the garment. It protects you from any rubbing. It protects you from over squeezing the garment too tight, and it protects you and your incisions from being crushed or damaged by any seams or really rough material. Some of those garments are really, really rough, guys. The Amare garment isn't. I'll do a whole nother video on that, the one that I designed for this reason, but this is going to protect you from that. Number two, it helps lymphatic movement. This polyurethane lipo Amare foam is an accelerant. What does that mean? So the gentle pumping motion that we use, the hands-on lymphatic drainage, where I'm just moving, where I'm just gently moving the skin. See how my skin moves? That's what you want. You want gentle skin movement. When you have something adhesive, there's no movement. There is no lymphatic anything. When you have something that's memory foam that's pushing into you, it's trapping your skin. Your skin is not moving. With this, it gives you that little bit of a barrier and cushion so that anytime you move, anytime you breathe, anytime you're up and about, which you should be, guys, after surgery, at a certain point, you need to be ambulatory. What does that mean? You need to be up and moving around. Get that stuff flowing. Get moving. Circulation. So as you move, this foam is sitting against your skin, and anytime you move, it's moving like this, moving your skin in any direction. That's the same motion we use in lymphatic massage, true hands-on manual lymphatic drainage. So these actually give you that stimulation to your lymph vessels and your fluid and your skin while you're wearing them 24/7 in your garment. So it's protecting you, but it's also helping that swelling start to filter out a little bit in those areas. Even if you're not getting true hands-on manual lymphatic drainage, this is still going to help your swelling because it is, like I said, an accelerant for your lymph system, and your lymph system is responsible for processing out that swelling through your body. So that's that. Now, the biggest thing we use these for is fibrosis. Why? Because, again, they're protecting you from your garment. These help turn fibrosis back into that liquid state for your body to reabsorb and pee out. Again, as I talk about in the fibrosis video from last week or the week before, your body does not break down fibrosis. That is not how that works. Fibrosis is lymphatic fluid that got crushed by a faja or trapped by a bad foam or a board under your skin that is now creating a pool or a puddle of stagnant fluid that's not moving, that gets dehydrated and hard and starts to adhere under your skin like a knot. That's fibrosis. What these do, again, because fibrosis is caused by the lack of movement due to this piece of foam against your skin moving, it helps actually dissolve kind of the fibrosis. It gets that movement back to that area where it was trapped and there was no movement at all. So it starts to help move that area so that the fibrosis can start to dissolve around it and the swelling can come down around it. That is the number one thing we use this for. These Lipo Foams are for fibrosis. Yes, they are for protecting. Now, they also prevent fibrosis. How? By making sure your skin stays moving and you get proper circulation in your garment, no matter what garment it is, proper circulation in your garment to make sure that you're not developing any of those fibrotic patches or any patches anywhere on your body that aren't moving or aren't getting any lymphatic movement at all. So this makes sure that everything stays moving and circulating and healthy. It's not being crushed. You're preventing any of that fibrosis from happening, and you're protecting yourself from the garment, from any burns or any like crushing or anything like that. Now, the one thing I hear people say most about this that they love is that usually with zippers on the side of a garment or a garment that's not cut right at all and has no zippers or seams like a merino garment, this gives them support. So when we put foams in, and this is why I say, guys, on that product page, you need 2 packs of foam. The Amare foam comes in a pack of 3. So you'll get 3 of these in 1 pack. I say get 2. Why? Let's say you only had lipo on your stomach, right? You didn't have any lipo on your back. That's fine. But the garment or the binder that you're using, compressing all the way around, is going to give you back problems at some point. It's going to hurt when you sleep. When you're trying to sleep or lay on your side, when you're trying to sleep or lay on your back, that garment's going to dig into you. So what do? We put these in all the way around. And I'm going to show you how to do that at the end of this video. But we put these in to make sure you're getting full support all the way around. Again, the biggest thing I hear that they love about these is it gives them support. It gives everybody support in their garments. So let's say, more extreme case, you had a tummy tuck, right? You get that hunched over thing from the tummy tuck because everything's pulled so tight. Putting these in the back where the garment is pulling you will actually hold you upright and give you support. The main reason people use boards in their garment post lipo is because they need to protect themselves from the hooks in the front, and they want support, right? Because it cushions. You don't need boards if you have this, because this is sturdy enough, as we've already seen, whereas these just collapse. These are sturdy enough in your garment to give you that upright support front and back, which is why it's super important that even if you just had stuff done in the front, you're doing the foams in the back as well, because it's going to cushion you front and back and sides all the way around to hold you upright, make sure you're getting proper circulation, and protect you from those hooks that are pulling you down, or protect you from the weight of the garment pulling you down. So front and back is how we use these, not just in the front, not just on the areas where you had lipo or where you had your surgery done. Now, fun little thing about these, you can cut them. In my sessions, Cleo's tail is in the way. In my post-op sessions, depending on if you had like a breast aug or something like that, I cut these to fit in your garment. So I would not suggest just cutting these on your own and making a chop shop out of them, because you want to make sure that they're covering you properly. So what I'll often do is cut them into strips like this. If you had a breast aug, we'll cushion around or on top of or on the side, wherever you have that swelling issue, wherever you have that fibrotic patch, we'll cut this so it fits in your garment perfectly. Now again, like I said, this is any garment. So if you're wearing like a sports bra where you're having that swelling issue, or you want to make sure that your incisions heal without any bumpiness and they hold together better, you're going to want to cut this. Usually fold it in half like this, measure to make sure that it's fitting, and then cut. Or fold it in half like this, fit it, measure, make sure it covers the whole thing, and then cut, and then put your garment back on over it. So that way everything is covered properly. So these can be cut to fit where you need to fit. But most important things about this foam: 1, it is sturdy enough. 2, there's no adhesive, so you're going to make sure your skin is healthy and moving. 3, it protects you from your garment and gives you support, guys. That is the biggest thing. I know you guys have the faja struggle out there. I understand that swell hell is real. This will make your life so much more comfortable. Even if you're not wearing an Amare garment and you're wearing any other kind of garment on the planet, put these in your garment front and back, not just in the front, not just on the sides, front and back. Be covered 360 all the way around. Make that faja as comfortable as you could possibly make it. So, biggest point about these things that I haven't mentioned yet that I want to mention. I did a little bit. These, like, memory foam things, soak everything up. Cleaning them is impossible. And if they have adhesive, cleaning them is even more impossible. So, these are in your garment 24/7. You're sweating, you're leaking, you're in pain, blah, 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 blah. And mind you, you should be wearing these 24/7 with your garment until you're out of your garment. So sometimes it's 6 weeks, sometimes it's a little bit more. It depends. Those don't wash well. They actually don't wash at all. They're kind of gross. And usually you have to keep buying more and getting new ones because they get gross and they get dingy and you want new ones. Okay, great. These are fully machine washable. Our Amare Lipo Foams are fully machine washable with our detergent. If you use Tide Gain All store-bought detergent on these things, they will dry out and crumble to dust in your garment. They will start flaking, they will become brittle, they will break. If you take care of these, they will take care of you. I have a client who purchased these Lipo Foams for me a year and a half ago. She washed them every like 3 to 5 days, sometimes a little bit more, with the Amare recommended detergent that we have in our post-op shop. She still has these for her 3rd surgery. It was weight loss. So she did tummy tuck first and thighs, then she did lipo and BBL, then she did breast and arms. We were still using the same 6 foams that she had from a year and a half ago up until this month, because she washed them properly and took care of them, and they were still in perfect condition, still completely supportive all the way around, and still completely clean. Yes, they look a little beat up, but they still work. So I just want to show you guys, when you wash them, this is what they're like. They're like white, right? When you get them, when you wash them, they're going to turn a little bit like darker because you're washing them with your faja, which is fine, depending on the colors of your faja and what you're washing it with. That we don't care about, as long as, and I've washed this like 6 times and it's still super like spongy and it cleans all the way through, whereas the memory foam just sucks up all the water and stuff. So how do we wash these? The same way we wash the faja, the same instructions that are on the post-op shop detergent shop page for washing. You are going to take a little bit of that detergent, you're going to sprinkle it over the foams, you're going to put it in the washing machine, delicate only, guys. If you use anything other than delicate, these things will get ripped to shreds in your washer. So delicate setting only, with our detergent only, cold water only. And then you can take them and put them in the dryer, air dry, cool, delicate, fluff. Whatever of those settings you have, you want to make sure it's delicate and cold. So the rule for washing your garment and foams from Amare is delicate and cold, everything. Now you can hand wash these. If you want, same thing, cold bucket of water, sprinkle some detergent on them, squish them like a sponge, get them soaked, get them saturated, wash them through and through, rinse them, squeeze them all the way out, and then hang dry them. They'll clean the same exact way. Now, quick little life hack. Guys, you're all leaky. You're a mess, right? These things can get pretty gross. So, quick little life hack. Take these foams, put them in a bucket of cold water with the detergent, and squish, 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 squish. Put a little bit of peroxide in there to get the stains out. Squish, 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 squish. Then take that whole basin of water, dump it into the washing machine, soap and all. And then put a little bit more of that detergent in there, sprinkle it in, cold, delicate. Let that go through the delicate setting in the washing machine. Take them all, either hang dry them or put them in the dryer. Cold, air dry, fluff, delicate, whatever you got. That will get them to turn back to looking like this. And they will be perfect every time. So again, you guys are going to need 2 packs. You're going to need 6 foams, regardless of whatever surgery you had. Now, if you are in a binder, these are extremely important. You guys know who are in a binder. If you're in a binder, it's usually because you're from Miami and your doctor didn't give you a garment, or you had drains. If you have drains, which stick out right down here, they usually don't want to put you in a garment because it's going to clog and, stifle everything, which is fine. If you are in a binder, the binder is that long white elastic thing. It's usually elastic. Sometimes it's like a little stiffer. And it's got like the Velcro on it. And you take it and you wrap it around yourself. The problem with the binder is the same problem with the fajas. You over compress and then you cut off the flow of the lymph fluid, and then your swelling can't drain out normally the way that it would. You can't reabsorb that because it's being trapped by the binder. If you have these in your binder, you will not overcompress yourself. There's no way, because these are fighting the weight of the binder. So you'll make sure that, one, as we know, when you wear a binder, if you've ever worn one, or if you're gonna have one, that thing will cut into you. Anytime you move, it rolls. Where it ends is here, and like right where your drains are. Anytime you sit or lay down, that thing is gonna collapse and cut into you. There's no structure at all in a binder for compression. It's just a white wrap. So with these, you're gonna put them all vertical in your binder. It usually takes 4 of them to cover end to end with your binder, but you're gonna take all 4 end to end just like this, put them in your binder, put them on you, and then wrap your binder around you so that these are protecting you from crushing from the binder. These are also going to give you that little bit of lymphatic swelling kind of thing for the relief. And it's going to make sure that your drains are also not getting crushed by the binder, because where that binder ends is right where the holes of your drains are. And a lot of times when you pull that thing, it's cutting right at that same area, even with a tummy tuck. And it's very common, almost all the time with a tummy tuck, to get a binder right away. So this will help a lot with protecting your incisions, protecting your body, making sure the binder doesn't crush you. So all of them vertical, side by side, put them on your body. That's how you do it with the binder. Now, with a garment, we're going to put 2 in the back. You're going to put 1 right on your lower back. Now, if you had a BBL, you don't want it touching your BBL at all. So you want to make sure right where that BBL line is, it goes right on your lower back. You're going to do that. You're going to put your right strap on so it'll hold this. You're then going to take another one and put it on the top. Just like that. So they're end to end and they're covering your back. You're going to put your left strap on. Then you're going to take another 2 foams, and you're going to put them vertical on your sides. Now, if you've had a tummy tuck, you want them to come a little bit lower so that they cover about 1 inch or 2 below that tummy tuck scar. So that way, the whole thing is protected and you're protecting that incision. If you've had lipo and you had lipo all the way up here, you're going to move them up a little bit because you want to make sure, Cleo, you want to make sure that all that lipo area on your side is covered and protected and getting that little bit of accelerated lymphatic movement so that your swelling can start to process there a little better. So 2 on the sides vertical, and then you've got 2 in the back horizontal. You want to make sure that they're touching end to end. You want to make sure that there are no spaces. Then you're going to do 2 in the front, 1 for lower pelvic region. When you put this in, you want it below your belly button. So belly button's here, you want it to be right below your belly button. Then you want 1 on top, just like that. And again, they're touching end to end with the ones on the sides here. So just like that, and you're covered 360. So what I suggest is when you put the lower pelvic one in, tuck it into the legs of your garment and then snap your garment up just before you close it over the foam, like 1 hook right before it's closed, and then you're gonna stick the other one in. Now when they start to overlap, you always want the front ones underneath the side ones. So if they're overlapping, you want them like this. So that way this isn't popping out while you're trying to button up your garment. Now, that's how you do that. So you got 6 foams, 2 in the back, horizontal, 1 on top of the other, 2 in the front, horizontal, 1 on top of the other, 2 on the sides, vertical, and they're all touching end to end all the way around. That's the general rundown. Now, if you are having trouble and you want to make sure you're doing this right, set up a virtual with me. If you want to get the foams proper and cut proper and make sure they fit proper, set up a virtual with me because it's very specific for every single surgery. It's very different for every single body, for your shape, for your size, for your surgery. So we want to make sure we're doing this right. So 732-841-0142, call the office. It's on the Instagram, it's on the website, it's everywhere. Call the office, set up a virtual with me for custom foam stuff. But things to think about with the foam. Number 1, you are going to get lines on your body from anything hard that you use, right? From trapping fluid. Now, if you already have fibrosis and you have this foam, if you have fibrosis all the way around 360, which a lot of times it is, you have fibrosis all the way around. These foams, you're going to start to see lines because you're putting these on the fibrosis and it's breaking up the fibrosis. Now, how do we know the difference between lines that are being caused by a bad garment and lines that are being caused by the foam breaking up the fibrosis? One is soft and one is hard. Hard lines on your body, like hard tubes and indents on your body, that's from a garment that's trapping fluid. When you start using these foams, those lines are going to be soft and squishy. They're going to be equivalent to the lines of a hairband on your wrist. You know, if you wear a hairband or something on your wrist that's a little too tight and you get those like little lines, they don't hurt. They're just like little lines from the hairband. And you take the hairband off and after a while, those lines start to filter out and go away. It's the same thing. So lines from the foam is common, it is normal, it just depends on which side you're on. Now again, if you are not sure, set up a virtual with me, because then I'll be able to tell based on what you're doing with your aftercare. But lines from foams are totally normal, they're nothing to freak out about, they're totally fine. But that is the other reason that doctors tell you not to use foams or boards, is because they don't want lines, and they tell you to wear a tank top under your faja because they don't want lines. But nobody ever tells you why or what they are. They just say, oh, those lines are going to become permanent. Well, if they're fibrosis, yes. But if you already have fibrosis and you're using these foams to break down that fibrosis, where the foam touches end to end, yeah, if you have fibrosis under there, it may be a little bit of a line. That line should be soft and squishy. When you have fibrosis from an adhesive foam, when you have fibrosis from a board, you can literally trace the outline of that board and everything inside of it is hard. And the line itself is hard. When you have lines from the foam, the lines from the foam are squishy and soft, or starting to get squishy and soft. And the area inside of that is starting to get squishy and soft. That's it breaking up. That's not the other way around. You already have fibrosis under there that's starting to break up. And those lines will go away as your body starts to filter and process out and become a lot more soft. Think about it like Play-Doh, guys. If you have like a wet, squishy ball of Play-Doh, right? And you push really hard into it and indent your finger, you're going to get lines all the way around on the outside, and that part is going to be indented, right? But if you're using a rolling pin and you're rolling it out, that area is going to become flat and soft, and then you're going to see the lines from where the rolling pin were on the outsides. And then you roll the rolling pin over it a little bit more, and it's flat and perfect, versus an actual indent that's hard. It's the same thing. But again, guys, if you're not sure, set up a virtual with me and we'll help you figure it out. But those lines are nothing to worry about. If you're getting true, proper hands-on manual lymphatic drainage and you're using the Amare Lipo Foams, those lines are going to go away because they're breaking down that fibrosis. That is totally normal. Again, equivalent to the lines of a hairband on your wrist. So, super important things. One, not all foam is created equal, as we know. Memory foam, where you can squish it and feel your fingers in between it, and a foam that has adhesive, and foam that is like a big chunk, a big block. All those are bad. They're going to cause havoc on your results. Polyurethane foam, Amare Lipo Foam, fully machine washable. You need to be washing it. It's in your garment with you 24/7. That's really gross if you're not washing it, because all of that sweat and all the fluids and all of that is in there. The other foams do not wash and disinfect properly. They wind up soaking everything in, and they take forever to dry, and they're like a really heavy wet cloth, whereas this is a sponge, and you can wring it out and it dries through and through. Totally different. These foams prevent fibrosis, help with lymphatic movement, first and foremost, protect you from your garment. They push the garment away from you rather than the other foams that collapse under the weight of your garment and push into your body. Same thing with a board. It pushes into your body under the weight of the garment. Same thing with that sponge, pushing into your body. These foams push away. They make it a lot easier to be in your garment 24/7. So those are the key points. Now, again, these foams are an accelerant. They will help that swelling. They will help that lymphatic movement. They will help your body start to process that out. So that's the thing with the foams. And those are the foams that we have in our shop online. The shop is the link in our bio. I'll also post it in this video. And drinking lots of water, obviously, helps with the fibrosis and processing it out and getting you in your faja and stuff like that. One more important thing, and then I'm done, I promise. These foams help you get down into a smaller garment. So they're about 1/2 inch thick and then all the way around your body. So they do help you fill out your garment a little bit. So if you're in a garment where it's too big on you, but you're too big for the next size down is too small. If you're in an extra large or a large and you're on the last hook and it's loose, but you tried getting into the smaller size down, the large, and it's too tight on the first hook and you can't bear it, put these things in. They will help you shrink so that you can comfortably get into the next garment with the foams. So they accelerate the rate at which you shrink down into. So if you're having trouble getting into your smaller garment, get these foams. One, they're going to help you fill out. If you're waiting for your smaller garment from your surgeon, or if you're waiting for it online, get these foams. They will get you by and give you that soft compression so that you can fit into the smaller garment when you get it. And that way you're not just in a big garment out here swelling up, filling out the garment. The foams will fill out the garment, still give you that soft compression so that you don't blow up in that larger size until you can get into something smaller, whether it be with time or if you're waiting for your doctor or whatever it is. So these are really good for bridging that gap in your garment where it like doesn't exactly fit right. Even the Merino garments that have no, form to it at all, it's just like a big elastic sausage casing around you. If that's not fitting right and it's tight, it's like tight, and it's the smallest size, but it's still not doing enough, get these foams, put them in the way that I showed you, and that will help bridge the gap a lot. I just have 3 foams, and I just ordered 3 more. Yay! Hi, Jocelyn. Yes, I did see that. Very nice to see you again. Yeah, but you're going to need 2 packs, regardless of what surgery. And also, guys, you're going to be washing them. So 1 to wash, 1 to wear. Kind of makes sense. 1 set to wash, 1 set to wear. And you can always order more. It's always better to have more. God forbid you do accidentally not put it on the delicate cycle and mess it up, or you do leak everywhere and don't have time to wash it. It's always better to have more because, again, you can always cut them and do whatever you need to do with them. So, guys, that is my very big foam video. I hope to see you all very soon. Have a good rest of your day. And if you have questions specifically pertaining to your surgery with the foams, your garment, fitting you properly, trying to struggle bust your way through the whole garment situation and make it fit properly, these foams are the key to that. We can rig your garment to make it fit perfect and be super comfortable and get you the compression you need without having to flip-flop and buy a million garments. So I will see you guys soon. 732-841-0142. And that's it. Have a good rest of your day, guys. Bye.